Thank you, and thank you for everybody for joining us today. And we're very much excited to be presenting, recognising and reflecting upon the evolution of school-based social work here in Northern Ireland. And if we go to the next slide, Alison, that'd be brilliant. So just to give you an idea of what we're going to discuss today, welcome and introductions. As I said, I'm Dylan Sloan. I'm the chair of the School Social Work Network here in Northern Ireland, and I'm also a PhD researcher exploring the field of school social work in Northern Ireland. And I also practice as a school-based social worker. So I'll be going through introducing you really to what is school social work, what does it entail. There's definitions along where it sits internationally, nationally, and locally. And then I'm going to pass on to Charlene, who's going to go through a day in the life. And then after that, Emer is going to bring us through the impact of school social work. How do we measure it and what does it look like? And then we'll bring us through the closing, reflecting on some of the presentations. And then we'll have the opportunity for you to ask questions and for us to rack our brains to find some of those answers. So as Alison said, if you keep some of those questions in the chat, that allows us then to go through and answer those questions. So that's brilliant. So if we go to the next slide, please. So yep, as I said, I'm Dylan Sloan. I work in Abbey Community College, which is based in North Belfast, as a school-based social worker. And as I said, I am undertaking research in the field of school social work as well. The next slide. So what is school social work? School social work is well developed internationally. Having social work in the field of education isn't new, and it certainly isn't new to Northern Ireland either. Northern Ireland is one of the only devolved nations within the United Kingdom that still require social work qualification for education welfare officers. So we do have social workers that are currently working within the field of education. However, one of the main differences that differentiates the education welfare officer from school-based social work is that role and function. So how do we then define school social work? And we look internationally at some of those definitions. So the National Association of Social Workers in the United States, where school social work really caught on in terms of its history, defines it as school social workers are often called on to help students, families, and teachers address problems such as truancy, social withdrawal, aggressive behaviours, rebelliousness, and the effects of special physical, emotional, or economic problems. On to the next wee slide, Alison, if that's okay. But if we look at that definition, we break it down a little bit more about what is the role. We draw upon Frey 2013 and his research in defining school social work. And they have said that school social work is the home, school, and community links. So again, we're using that systems approach where we have our student in the middle, and we're looking at what a school social work does. So it's linking home, school, and community to ensure that that child is getting timely interventions and support. It's about working alongside the ethical guidelines, obviously through our regulator, which is the Northern Ireland Social Care Council, and internationally developed countries have different regulations and regulators, and also adhering then to educational policies and legislation such as the Education and Libraries Order Northern Ireland 1986. We then look at data-based decision making, so that's evidence-based interventions. We're looking at, as Charlene and Emer will touch on, what our practice is telling us, and then what interventions we can put in place to support that child. Educational rights and advocacy is also a critical component of the role, and Frey breaks it down into three critical components. Critical component one is providing that evidence-based education, behaviour, and mental health services in the school. And I suppose that's one of the things that differentiates that education welfare officer role from the school-based social work role, is that place-based initiative of having the social worker embedded within the school. Critical role two is promoting a school climate and culture conducive to student learning and teaching excellence. And finally, critical role three is with regards to maximising access to school and community-based services. So again, linking those students in to get timely support through their communities and being aware of that community development, which is integral to social work practice. On the next few slides. So to understand where school social work sits in Northern Ireland, we must also look at where it sits internationally. And you'll see from this visual that at present, there's over 50 countries that recognise and employ school-based social work. The United States of America, which I referenced there, was very much at the foundation of this and driving that change. And currently, the School Social Work Association of America recommends one school social worker for every 250 pupils. So they have already started to embed some of those workforce and workplace regulations to ensure that those students are getting the support they need. In Sweden, it's mandated within the Swedish Education Act, and in Sweden, they refer to the social worker, and forgive me if there is any Swedish people that do end up watching this, but as a skolkurator, which means, when it's translated, is the one who cares. And I just thought that was really lovely, and that's how they refer to school social work. Again, it's as far afield as India, and it's embedded within their education system. It was recognised in the Indian government in the 21st century. So just to give you an idea of where it sits internationally, but now we need to look at, well, where does it sit in Northern Ireland? So if you go on to the next slide. So currently we have 6 school-based social workers across the province. You can see from the green dots, that's roughly where those school social workers are based and are practicing in. Each school social worker is assigned one school in Northern Ireland. That's the way we're operating at present. We have had some research in different countries where they oversee many schools. And I'm really pleased today to say that we have, out of those 6 schools, it represents all the different governing bodies within education. So we have Emer representing integrated education. We have Charlene here today representing the Catholic maintained education. I myself from that control sector as well. So it's really, really nice to see that school social work is going beyond those segregated sectors at times. On to the next slide. So how is it developed then in Northern Ireland, and where are we presently? So we established our network back in 2024, and that was just responding to some of those grassroots schools that were saying we're eager to employ a social worker, or some schools that have started that journey and venture. And we now have a network with 6 practitioners alongside with our key stakeholders. We have representatives from BASMA Northern Ireland, the Northern Ireland Social Care Council, and we also have representatives from the Education Authority. As a network, we're working now alongside BASMA Northern Ireland, and just to do a wee token of appreciation here to Charlene, who's just recently been made a member of the BASMA committee, which is amazing because we have a school social worker sitting on that. But that's allowed us now to explore formalising our network into one of those communities of practice. Furthermore, we were delighted to consult with the Northern Ireland Social Care Council, Education Authority, and British Association of Social Work in creating and feeding into that creation of the school social work guidance that NISC have now produced. And a massive shout out there to Mandy Cowden, who was phenomenal in supporting us in producing that, and Colin Reid as well. So we're starting to see that formalisation starting to occur in Northern Ireland, which I'll talk about a wee bit later, but that's bringing quite a bit of international recognition and attention to the country as well. Next slide. And as I said then at the start, I'm doing a bit of research into school-based social work. So my PhD title at the minute is Investigating Education and Social Care Staff's Perspectives on How School-Based Social Work Impacts the Wellbeing of Post-Primary Young People at Risk of Statutory Social Work Intervention. So again, Northern Ireland is very unique in the sense that we have our regulator body that has produced these standards and guidelines. We have current research going on, and we have some schools that are using their funds to establish the role of school social work. And as I said previous, through the Northern Ireland Council, Social Care Council, and the development of those guidelines, that generated quite a bit of international interest in how we're practicing here and how it's developing. So we've had interest from colleagues in Australia, colleagues in the United States of America, in Kentucky, I believe, and colleagues in Malta, Denmark, and right across the United Kingdom and Ireland as well. So it's quite nice to have that recognition. And as the network, we are keen to meet with all those different representatives internationally and learn from their experience as well as them learning from ours in the development of it here in Northern Ireland. So that kind of gives you an overview of where school social work sits in Northern Ireland from a macro perspective, looking at the international, right down into Northern Ireland and where it's sitting currently. And I would like now to pass over to Charlene, who is going to go through then a day in the life of a school social worker and what that really entails.
Thank you. Next slide, please.
Oh, apologies, I didn't. That's just some information for Abbey Community College, where I practice, and that's just some parent feedback. And again, there's another wee slide there that goes through the roles and responsibilities in terms of school-based social work. So you can really see what I was talking about earlier, that the scope of the role does fall into safeguarding, linking to external agencies, looking at those critical components, family support and student engagement. But as I said, it's over to Charlene, who's going to go through that a bit more in depth.
Afternoon, everyone. So my name is Charlene Hill, and I have been school-based social worker in St Ronan's College in Lurgan for just over 2 years now. Prior to this role, I was a family intervention social worker practicing both in Scotland, where I started my career, and then in Northern Ireland. And as Dylan's just said, I'm now also a member of BASWA Northern Ireland, the committee. In this section, I'm going to attempt to give you a flavour of a day in the life of a school social worker, but very similar to most social work roles, the day-to-day can vary and change at the drop of a hat depending on what the need is. Next slide, please. So in terms of role and responsibility for a child and young person's well-being rests primarily with their parents. However, every school has a duty of care to the young people in their charge. St Ronan's College identified that resources in their local area were significantly reduced due to funding cuts and then as a result of the COVID-19 pandemic. And as a result, it was their vision to provide in-house support to pupils and families to address need and prevent families reaching crisis point. So this is how the role of school social worker was born in St Ronan's College. So given that I was new to the role of school social work coming from family intervention and that the role was new to college, it's taken a bit of time to continue and develop. And over the 2 years that I've been in post, that role has continued to evolve and now consists of a number of elements. So firstly, I oversee all safeguarding matters in the school, including staff training and investigations. And then I'm responsible for supporting all pupils that are open to statutory services, such as social services, to the police and to CAMHS. So I work with pupils on the Child Protection Register, our care experienced young people, and those that are receiving family support intervention. So research has evidenced that young people with adverse childhood experiences are less likely to succeed in education. So I monitor these pupils' education journey. I offer check-ins, I liaise with parents and guardians, compile reports and advocate on the behalf of these young people at statutory meetings. The other part of the role is providing an early intervention support to pupils and their families, and this is to avoid families going into crisis and requiring input from statutory services, which we know were already overstretched. Next slide. So I work closely with our senior leadership team and our key stage directors to identify issues that can have a detrimental impact on the education attainment of any young person if left unresolved. So on the screen, you'll see just some of the key areas of concerns that we have identified over the past 2 years. And I'm going to move on in the next few slides to discuss some of the initiatives and programs that we've developed to work directly with our young people. But as you can see, it's things like social media, that's cyberbullying, sharing of inappropriate content and images, exposure to domestic violence or issues at home, emotional school-based avoidance, which we think is one that has increased significantly, obviously, since the COVID-19 pandemic, mental health and well-being, and then the likes of vaping and use of illegal substances. Next slide, please. So we currently have a toolkit of around 20 educative programs which we offer in-house. So for example, we have our Give Respect, Get Respect program. So this is an educative piece of work to address inappropriate and abusive behaviours in school. Initially, this is a program that was used only with pupils that were identifying these behaviours, but we've since rolled it out to all pupils and have involved our prefects in program delivery. Our aim is to ensure that a culture of respect is developed within our college. We also have our Friend and Foe program, which is about navigating peer relationships. All About Me is for addressing low self-esteem and confidence. And we have the Aware program, which focuses on school avoidance, anxiety and well-being. We work closely with colleagues and police who will attend the school to support in the delivery of these educative messages to young people, helping them to understand the impact of behaviour on their lives and what those behaviours could lead to in terms of consequences or charges, for example. So on the screen as well, you'll see another few programs as well. So we have our Return for Refusers, so working with those young people that are avoiding school for whatever reason, and we offer one-to-one support, home visits, pastoral work, bespoke timetables, and our punctuality initiative, or Ready to Learn, as we kind of call it in school, which is opportunity for pupils to meet with staff in the morning, ensure that they're fully equipped and set up for their day, and to grab a quick bite to eat. Next slide, please. So alongside our in-house support, we also work closely with the external support services in our local area. And again, this is to fully maximise what support is available to pupils. So we have pupils going out to our Main Sheds programme. We have both Reach and Links Counselling and Start 360 and Drumgour Detached Youth all come into school to provide support. And then, as I've said before, we have really good links with our link officer in the community police, and they will come in and support us to speak to pupils if there's been specific incidents, or just they will identify things in the community and will work with us to provide that educative message to our whole school. Next, please. So in the next two slides, I just want to go over a couple of case studies and go through the response provided by school. So in this first case study, we're looking at a young person who has been involved in an incident whereby they supplied another child with a vape in school. The child used the vape and then passed out and attended hospital following the use of same. So we had increased concerns regarding presentation in school, concerns about addiction to THC and spice being inhaled via the vape, and obviously a child ending up. This child then moved on himself and ended up hospitalised following a suicide attempt. So in terms of support offered, so we offered educative work to the young person, which was delivered by school alongside our community police officer. So they come in and we spoke about vaping, we spoke about the consequences of sharing that vape with somebody else, and given that it was THC that was in that, then what that could mean in terms of charges. The young person was given one-to-one sessions with myself within school. I had regular liaison with home, with mum, in terms of supporting them to manage the fact that it had been identified that their child was using substances. With consent of parents, we then made a referral to Gateway Social Services team and brought them on board in terms of supporting the family. We also made a referral to Dunley Addiction Service, again with consent of parents and the child, in terms of getting him that specific tailored support. And as I say, then liaising with our community police in terms of the police further investigating that incident that took place within the school. So as you can see, there's a number of pieces of work that we were able to conduct in school in response to that situation before having to call on our external supports. Next week case study, please. And then in case study 2, we're looking at non-school attendance. So we had child C who was a school refuser, and at the point of referral to me as school social worker, he had only attended one day in the school term, which was the induction day. So he had been referred to Education Welfare Services in the February 2023, and this was actually last year that I picked this one up. So he had been on the waiting list for just near a year when I picked it up. And his mum was reporting that it was anxiety-based school avoidance. So in respect of our school response, because I'm not timetabled as such as teachers, where I was able to offer up that space and time to undertake 3 separate home visits to that child at home, in terms of building that relationship and linking him back in with school, making that link to St. Ronan's College. We then had a visit with him to school when it was the end of the day and other pupils weren't there, just to get him back onto our school site. We offered one-to-one support via the youth worker and social worker. So initially he was receiving 3 one-hour sessions per week. That was only that pastoral support from myself and the youth worker. And we then aimed to build on that. So we then were able to build on a reduced timetable where we had him in daily. So at the point of writing this wee slide, he was receiving 13 periods of teaching, 2 registration periods, 2 hub support periods, and one period of pastoral support with myself or the youth worker. That was his timetable, and our hope at that point was that we would get that child back to school in September of 2024, and I'm glad to say that he is back in school and is now on his full-time timetable. So we were able, with that support and that really drip feeding and building that relationship back with school, to get him back into the school environment. Next wee slide, please. Last one back the way. Try again. I'm looking for the wee pupil and parent voice slide. If it's there, thank you. So finally, I just want to touch on the response from our parents and partner agencies. So a lot of groundwork has taken place to embed the role of school social worker. And this has involved information in the role being shared at open nights, at induction days, in assemblies and on social media. So social work, as you know, remains a profession that is highly publicised for the wrong reasons. So we didn't want the stigma to impact on the engagement with this service within school. So we have obtained ongoing feedback from pupils and parents who have received the service. And as you can see from the comments that are up there on the screen, our pupils have really embraced having a school social worker. They've found it as a useful resource. They find the open door policy and access to support when they themselves are in crisis as helpful. Parents have been reassured by the fact that their children have someone and somewhere to go when they need support, and the parents themselves can't be available given that they're in school. And finally, colleagues and statutory teams have been very positive. They've found having one point of contact in school as a more consistent and resourceful means of sharing information and ensuring that pupils are supported and aren't missed, that they don't fall through the cracks. I'm going to move on now and share with or asked Emer to share a look at the impact of school social work.
Thank you, Charlene. So good afternoon, everybody. My name is Emer Rafferty and I'm a full-time school social worker at Hazelwood College. Proudly, I've been working within Hazelwood College for 4 years now, and my previous experience was within a local trust working for a looked after children's team. Next slide, Alison, thank you. Yeah, so just to firstly take you through some of the aims that I want to achieve by the end of the PowerPoint. Key areas of impact, not just obviously our students, but our guardians, our parents, our school staff, and obviously our external agencies as well. Measuring impact, why is it so important that we're continuously reflecting on our practice, and how do we do this in our daily social work role? I've provided a short case study in terms of safeguarding and neglect and the presenting issues that we had with a young person in school and how multidisciplinary worked with this young person. And then lastly, just some impact in terms of academic performance, particularly relating to our care experience young people. Thank you, Alison. Yeah, so firstly, for me, school social work, it is really important to kind of look at the demographic of the school that a social worker is working in. And I've used Hazelwood Integrated College as my example. Proudly, it's obviously integrated and encourages differences between students. We have a high number of free school meals. We just fall below the 50%, Darren, and we have a large number of care experienced young people, quite a number of children with additional needs in terms of statements and teaching assistant reports, high number of newcomers. And again, we also fall between two different trusts, so the Northern Trust and the Belfast Trust. Thanks, Alison. So impact, naturally, we all think of our students, and rightly so. We all have a shared goal really of impact in educational outcomes and student wellbeing. That is our main focus. However, it also involves our parents and our guardians, and that's through multidisciplinary work with both them and our external agencies, and also actually supporting our school staff. If we think of the culture within a school, everybody has to be on board with school social work in order for it to work. So I'm going to focus primarily just in relation to impact, looking at our care experienced young people to show and illustrate that. Thanks, Alison. So why do we measure impact? I think it's important to ensure that actually the needs of our young people are kept to the forefront of all of our planning. In other words, if we're just continuously to kind of go to work and come home, we're not really making any impact. The other side of it is actually professional accountability. Both me as a school social worker, but also my employers, Hazelwood Integrated College, employ me to make an impact on students' lives. Also, I suppose, accountability for our supervising social workers that obviously support us in this role, and obviously want to make an impact on these students. So how do we do this? Charlene has touched base on this already. And I start at least for our care experienced young people before they even walk through our doors in year 8. And that's about involvement in external meetings, and they involve PEP transition meetings. This is to get a better understanding of individual needs of students before they walk through our school gates. It's preparing them and our staff to understand their ACEs that Charlene has already mentioned, some of the challenges they maybe had in primary school and how we overcome them into secondary school. What we all know about career experienced young people is that they struggle with change, and what bigger change is there than a transition from primary school into secondary education. I'm a big believer in understanding children's abilities whenever they walk in. So I look at PIM, PI, CAT, and data drops. That allows me to set individual targets for each young person depending on their abilities and their needs. And that also plays into their emotional well-being in terms of, I'm stupid, I don't understand these things, I can't do this. And that self-esteem comes into that too. So if they have realistic goal sets for each term, it makes them feel more confident within themselves as well. That is a really big thing within school in terms of measuring impact. Continuously looking at attendance, behavioural referrals, termly reports, suspensions, and achievements. And that's really to assess performance outcomes and also look at negative or positive external influences and then adjust accordingly if targets aren't being met. Particularly career experienced young people, I find, particularly working in a school, I find that forward planning, that goal setting for the future isn't always there because they're not always talking about it. So we're really big in Hazelwood College about transition planning. And we do that from year 8, talk about their future, continuously have these conversations with young people and looking at their strengths, identifying their strengths so they are aware of them themselves. So in year 12, we are very much on year 14's plan A and plan B options. This is the ideal of where I'd like to see myself if I leave Hazelwood College, or if I actually stay on at Hazelwood College, what type of subjects would I like to do? And that is suitable career pathway for them, as opposed to you just go into that or you just go into that and not suit you. Lovely. Charlene has touched based on student and guardian feedback. It's been really, really beneficial in terms of measuring impact with individual students and also feedback just about where improvements can be made. And again, and make sure that we're always thinking of the student whenever we're planning. CPOMS is a system that is used in schools, which I have never worked with before coming into Hazelwood College. Really, really great piece of ICT in terms of documenting safeguarding concerns, external meetings, home visit, external referrals. It allows us as a school then to identify patterns and presenting issues within safeguarding and pastoral needs of our children. Again, professional, I suppose, accountability. I have to report to my Board of Governors in terms of termly reports and measuring my impact, and also provide GCSE and A-level analysis following results during the summer months. Thanks, Alison. Just the next slide. Cheers. Thank you. So just a brief case study to take you through kind of the work involved and the impact of this. So if you see the presenting issues on the right-hand side, we had a young person and he had very low school attendance, but a noted decline in attendance as well. Really, really poor personal hygiene in terms of actually other young people picking on this young person. Suspensions were coming through, really struggled with authority figures out of the blue, really would not follow any directions, absconding, bullying behaviours, really poor parental engagement, and we were concerned about safety in the community. Now, the broad kind of subject around this and our concern was actually neglect, which, as we all know, was very difficult to document. But actually being able to see every wee incident, every wee issue, and every communication that we had with these parents, the last kind of missing puzzle was actually a home visit. And actually, whenever the home visit was done, it was very clear that immediate concerns for this young person's safety and this family in general. Now, having a pre-established relationship with this child really benefit me in this scenario is that I could take the parent in, I could take the child in, present the concerns, and in that meeting say, look, we have to send a referral through to Gateway Services because there's immediate risk here. And the parent consented and was very much deflated by this stage. The children and the parents were actually removed from the home that day. I was able to offer one-to-one support with the student regarding routines, personal hygiene, additional home visits over the summer months to transition this young person back into school. And strangely enough, people probably think, how do people work with school social workers? Do they not hate school social workers? It's that relationship-based work that actually helps us whenever we have to have these difficult conversations with parents and students. And that has been the wonderful thing about this role and has been really impactful. We have also, obviously, I'm conscious in this case, it was a short-term intervention as well. Sorry, next slide, Alison. I might have talked on there. So what was the impact? What was the professional feedback? So due to the level of detail in previous intervention, we as trust social workers were able to threshold the case and acted immediately to visit the home. So school social workers, being able to understand thresholds, are allowed to put in then immediate safeguarding measures. I was then able to offer targeted support to this young person, and as a result, the student's school attendance improved by 15%. Student was in full school uniform, improved personal hygiene, better peer relationships, did not receive any further suspensions, and remains in the care of their parents, which is the most important thing. Next slide, sorry, Alison. So what was this young person's feedback in terms of school social work? The way that we kind of looked at this was the house of worries was the past, the house of good things was the present, and the house of dreams was the future. So the house of worries, this young person described a stressful home environment, not being able to sleep, bad mental health, and didn't have a lot of friends. Presently, enjoying school, going out more sleep, and I have more energy. And what do I want for the future? Better in certain subjects, going out even more, and no drama, which is wonderful. So how did they get from the past to the present? And they've noted better support from my family and social workers. And then from the present to the future, how do we get there? And I'm going to try a lot better. Thanks, Alison. Just the next slide there. Just suppose lastly, looking at impact in terms of our care experienced young people. Last year, the average school attendance for our care experienced young people was 92%, which is fantastic. Statistically, in Northern Ireland, it's typically, I think that's wrong, it's actually 79% of young people only achieve 5 GCSE or more. And actually in Hazelwood College last year, proudly 100% of our care experienced young people achieved a minimum of 5 GCSEs, A star to C grade, which is fantastic. And that, I suppose, is the impact in a academic performance. Capacity, some of the relationship-based examples are having that pre-established relationship with young people. There was a significant child protection disclosure in terms of sexual abuse. I was the trusted adult with this young person, had already established relationships with external agencies in terms of statutory social services. I was able to provide a narrative to staff, because obviously these young people were talking about the disclosure in school and staff didn't always feel equipped to manage that. And there was a subsequent placement breakdown that the young people were supported with. And again, then we actually invited external agencies, Childcare Centre and the Belfast Trust, to come and support our staff for future, I suppose, disclosures of this nature. And again, I suppose not all impact is quantifiable. That's definitely worth noting today. It can actually be seen really just in the relationships that we have within our students. And I suppose it's cemented really into the school social work culture. Next slide. Thanks, Alison.
Yeah, so I'll kind of close us up and draw upon reflections of the presentations. It's quite clear through both Charlene and Emer's presentation that that school social work very much strongly aligns with some of the recommendations out of Professor Ray Jones' Review of Children's Services in 2023. Particularly when I was looking through it, I was looking at Chapter 10, that there could be further development and deployment of multi-professional and multi-agency frontline teams and services to assist children and families. And I think today it's been quite evident, hearing from Charlene and hearing from Emer, that school social work potentially has a role to play within that. Again, looking at some of the recommendations from Professor Ray Jones, rearranged statutory services team structure to more of a community focus. And that was outlined in Chapter 12. And I think that's something we have been reflecting on as a group and within the network, is whilst we are not a statutory social work service, we are very much playing into that community development, and that social work and community development, which is integral. And I know that potentially Fergal's on here today, but she'll be banging the drum for that community development, no doubt about it. And again, reflecting on Professor Ray Jones, there was without a doubt a need for increasing funding and investment to respond to increasing poverty, creating difficulties for children and families, and allowing them to receive support and assistance they need. And again, anecdotally, I think the three of us, plus the other three social workers working in schools that aren't here today, would very much see our role evolving to combat some of that poverty that we're seeing in our communities. For example, we are in my role, I would be going to the food bank and lifting some of those parcels and delivering that out to families, and trying to secure local funds through donations of businesses. Abbey Community College has been very grateful to receive a donation of £500 so that we can assist our families to top up gas and electric. So once again, just feeding into that, Professor Ray Jones, and reflecting on that. Some of the other things that aligns very much strongly is the Children and Young People's Emotional Health and Wellbeing and Education Framework, which was obviously developed and produced in 2021. And I don't think I can say anything further than school social work really highlights all of the elements that are outlined within that document. Again, looking at our legislation that governs Northern Ireland, we're looking at the Children Northern Ireland Order 95 and the 5 Ps within that. And it's been quite clear today that the school social work is very much focused on that prevention, that early intervention. Charlene had mentioned about getting in there early to make sure that there's not a need for further statutory services. And again, Emer touched on that, and those short-term interventions as well. So that prevention. And again, one of the other elements is that partnership working. And I know at the start I discussed trying to define what school social work really is about. And it's about linking that home, school and community. So that partnership working is so integral to the development of the role, and again plays into that community development aspect as well. Again, looking at the Children and Young People Strategy in Northern Ireland 2020 to 2030, there's elements of practice that both Charlene and Emer have highlighted that fit well in within it. And finally, the Children's Services Cooperation Act Northern Ireland 2015, which I'll say a bit more on in the next slide. But I think that it definitely draws our attention to the importance of that piece of legislation and the importance for our governmental bodies, such as the Department of Health and the Department of Education, to work in partnership to ensure that these services, and there are services to promote the well-being of children and young people in Northern Ireland. I know that there's potentially some schools in the room today that have been very excited about the development of school-based social work. And I know one of the questions time and time again, it always comes down to funding and how do schools fund a school social worker. So there, currently in Northern Ireland, there isn't no official funding for school social work. Every school that has employed a social worker has had to be creative and find funds to pay that social worker. So it's very much out of the individual school's purse. There is one school in particular that was very interested in how they develop the role and how they receive funding. They have actually secured funding through a community partner who has stipulated that one of the outcomes of the school social work role is to really promote that community aspect, promote children accessing community services, and that's part of the school social work job description. So again, highlighting the importance of that home school community. I don't know if I can drum that point home enough. It's really, really important for those links to be in place. Another element that schools that I've spoken to use in terms of assisting the funding of the role is every school in Northern Ireland is awarded £1,243.68. Now, that's the last time I checked, so if there are any educational professionals on here that number has changed, you can let us know in the chat. But so that piece of funding is for every care experienced pupil in the school, and that funding is not restricted. Therefore, it can go into any pot within the school. So some schools have used that funding, in particular, like Hazelwood Integrated College, I would say, use that funding because part of Emer's role, as she has mentioned, and used fantastic case examples, is looking at those care experienced young people and looking at those transition plans and looking at the academic success for them and their future, which brings in that whole resilience theory as well, which everybody here has referenced and just putting a label on it. And then go on to the next slide, Alison. So given the development and expansion of the role across the province, I did mention there the Children's Services Cooperation Act Northern Ireland 2015. And I think us as a network, we are getting a lot of requests from different schools and from schools that are very much interested in how do we bring this role into our school and how can we fund this. We do believe that whilst we do not have an evidence base yet in Northern Ireland, I did mention there is current research going on through my PhD, which sets us up then, which we will have an evidence base. But I think it does warrant a further conversation between the Department of Health and the Department of Education in terms of how can this role be developed and how can it be measured in terms of impact. I mean, Emer did a fantastic presentation there about how we're measuring anecdotally within our own practices, but how can we then get that overarching framework to really collect data, measure, analyse and get the outcomes of what school social work is providing. And then I think that then warrants that further discussion between both of those governmental departments under the Children's Services Cooperation Act, because it does place a duty on the Northern Ireland Executive to invoke a strategy to improve well-being amongst children and young people across the region. It draws upon information in the UNCRC. The Act defined child and adolescent well-being against 8 factors: physical and mental health, which again, those physical elements I mentioned in terms of poverty, providing food, providing clothing, ensuring we're working with individuals that are homeless. And that's another thing as well that I want to touch on. A lot of people, and with Jerry Skelton's here, he'll be drumming this point home as well. But a lot of people assume that homelessness is people in the street. But as a matter of fact, our looked after children and our care experienced children are homeless, because where can their home be after the age of 18? They do not have a permanent address. So it's bringing all those elements in as well. And that's the physical aspect. And then the mental health, which Charlene and Emer have touched on, and myself, in terms of some of those different one-to-one supports we're providing in school. Living safely and with stability, again, looking at housing executive applications and how we can support families with those. And then learning and achievement, which Emer touched on fantastically in terms of analysing that data and looking at that data and those children and what their future plans are and securing a future for them, which is vital then in terms of that resilience, and they're further then on in getting a job and getting secure income and having a relationship, all factors that are measured against the resilience scale. Then economic and environmental well-being I've touched on, and the enjoyment of play and leisure. So even that, bringing children into school, you both touched on some of those emotional-based school avoidance, and the importance of having those children brought into school. Again, that plays into the positive childhood experiences. And I know I'm drawing a lot here on some of those academic and theoretical models, but I think it's very important to touch on. Obviously, a lot of the children that we would work with have adverse childhood experiences, but what we've touched on today is school social work being in a position to empower those young people so those young people can have access to positive childhood experiences. And one of those is access to school, which you've both highlighted in terms of meeting those home visits, going out, meeting the child where they're at, listening to the child and their voice, which again is so integral when we look at the UNCRC and articles within it. So that's where we're at then in terms of school social work in Northern Ireland and where we'd like to go. So we do believe now we're at a position where we are looking at legislation like the Children's Services Cooperation Act, and we would like to have a further conversation with government bodies in terms of how we can progress this, because it's quite clear that there's a lot of schools that are interested in it, and it's quite clear anecdotally the impact that it's having on our children, on our communities. And as Emer said, we automatically go to the children in the communities, but it's also having an impact on our statutory partners and colleagues in the likes of statutory social services. Charlene made a fantastic point and through discussions about how you have worked with certain young people and you've got them in the position where you didn't have to do that statutory referral. So again, it's about supporting our colleagues within the statutory sector as well, and also then taking some of the pressure off the likes of CAMS, the likes of community organisations, because we can get in there for those early identification, early intervention, and then prevention. And that's kind of then where school social work is sitting in Northern Ireland. That's our mission. That's what we'd like to see brought forward. Just one other point before we go on to questions and answers, which I'm hoping there's quite a bit. But there's a fantastic quote, and it was, "Social workers in schools pursue objectives common to all social work practice. In doing so, they translate and extend the common base of social work into a specialised practice." So it could be argued today that the role of school social work is a specialised role within Northern Ireland, and we need then the support through the likes of our regulator bodies, which we have had done with the NIST guidance, and now it's time then to bring that to a departmental level within governments to discuss this. So next then we're going to open up for some questions and answers. So the three of us are on the panel, as you can see. And we're very much open to any questions, and we'll hopefully have an answer for you.
Dylan, I'm maybe going to stop sharing and then we'll be able to see people.
Certainly, yeah.
You're very small on my screen, so and can you see the chat?
We can't see the chat. In fact, we'll go and try and open the chat.
Yeah.
And then everybody's going to get a close-up.
And I'll just stop sharing.
Okay, I'll go right up to the top.
Okay, yeah, so there are a few questions, so if you can read down through them, that's great.
Yeah. I suppose, will I just shout it out and then we can see? So the first question we'll have is from Fergal O'Brien. Love to see you here, Fergal. How does the role complement / interface with the education welfare officers?
I suppose I found that within St. Ronan's, I'd work very closely with the education welfare officers in terms of supporting young people. Obviously, they are looking fully at attendance and getting young people back into school, and I've been able to support in terms of offering some of those one-to-one programs and that actual direct work with young people. The education welfare has continued with their role in terms of the visiting and linking outside of school and attending those meetings, but we've come up with those education support plans and packages together with school social work, then doing some of that direct work that wouldn't be able to be completed by the education welfare officer themselves.
Definitely, in terms of the complementary aspect, I think through the presentations today, it's quite evident the complementary aspect in terms of school social work and education welfare, in terms of addressing some of those emotional based school avoidance, some of those attendance concerns. And that's, I guess, how then we would interface with the education welfare officer. As I mentioned at the start, one of the points that differentiate the roles is that place-based initiative we're embedded within our schools. Education welfare officers are obviously carry a caseload and are over a certain geographical area, whereas we're embedded within the school and support our students within that environment. Therefore, those students see us, 5 days a week, 3 days a week, and therefore it's more of that consistent approach with regards to the role. But there's definitely complementary aspects between both roles, and allows us as well. Like, I have done joint visits with education welfare officers where we have been able to both jointly support the family, and they're in a way looking at potential applications for free school meals and applications to get to school in terms of transport. And then in school, I can look at the timetable of the child, adjust that timetable because of the anxiety associated with certain subjects. So that's kind of how my interface goes with it.
Maybe look at the second question, Alison, is that all right?
Yeah.
Caroline, their transition PEPs have been around for a few years. What has been the impact on our looked after transition PEPs and their experience of school life, academic achievement in secondary school? Are the PEPs being reviewed through review processes? I have actually found, I suppose, the benefit really of having a school social worker in the school is really knowing and understanding that actually in recent years, don't quote me in which year, but the responsibility of who's to convene a PEP has changed a little bit. So primary schools are the person that are responsible for convening the transition PEP, which was never the case. It used to be the field social workers who are already slaughtered with other work. So that has been a positive change because there's pre-established relationships with our local primary schools for then our secondary schools. Some schools haven't actually done that, and it's good that I know that I can reach out and say, this child is looked after. We need a transition PEP to support this young person. And it has been beneficial for our young people. I think of my current year 8s who have had a transition PEP. I knew them in terms of what was working well, what wasn't not working well, what type of personalities they're going on with in school, and how will they cope with the changes, and some strategies to support them before they even came through the school gates. Offering them actually an additional visit up to the school. This is my office. This is where you will find me. This is potentially where your form tutor will be. This is the main office. This is the canteen, in a much quieter environment as well. So for me, particularly as I mentioned earlier in my presentation, was that change for our looked after children is massive, particularly primary school, one classroom, one key adult, to change to multiple key adults, and actually having a school social worker there that understands the processes outside of school that's impacting them, and obviously then in school and education as well.
Definitely, yeah.
Don't know, Alison, if you can scroll down, or no, we have to scroll down to me.
Want me to read it, or down?
Oh no, scroll down. Let's see. And see, sorry, just on the PEP one, obviously we're discussing there about the transition PEP. I think as well it's important, and Emer has touched on it there, in saying, and I think Charlene touched on it too in terms of your presentation, that as school-based social workers, we don't have a teaching timetable.
Yeah.
So we can be available to go to those personal education plan and those transition plans. And again, because of our social work knowledge, we understand, first of all, the social work process and what that child may be going through. Whereas the personal education plan typically would be, if you didn't have a school-based social worker, that would fall then to the designated teacher, the safeguarding lead, to attend that. But they also have a full-time teaching timetable or a few periods free to accommodate that role. And we've seen in the news quite recently that one of the reasons why teachers are still going on this action sort of strike is that workload pressure. So actually having that school-based social worker to understand the PEP and to go out and engage within that meeting and bring that information back allows them for that information to be fed out within the school as well. So I think that complements the school-based social work role.
Teachers to teach.
Yeah, which is the primary function of school, and the core business is to teach and learn, which we're here as the complementary supporting around that. Again, looking at that model at the beginning with the student in the middle. And if you think the student in the middle, then you've got your teaching staff and then your support networks and then your community. So it just plays into that. And then I've got a question from Claire Woods. Children with EBSA have symptoms of distress and harm before you intervene. What assessments are made to ensure we are not sending a child back to a harming environment in school? Considering the statutory autism commissioner has just stated at Stormont EBSA kids are the canaries in the cage for harmful school environment.
I suppose just from my own experience, it's actually consulting with our education psychologists within the school is really, really important, that, you know, identifying but also not re-traumatizing children by pushing them back into school when actually it's an environment causing this distress. And I think of a particular young person that I work with, we linked in with the education psychologist, and this education psychologist says this child is not fit for school at the minute. And it's actually going through statutory assessment. So I really take my directions from our education psychologists in terms of emotional well-being with children that have EBSA.
And I suppose, yeah, we're not working in isolation. We are calling on anybody that's involved, that multi-agency, anybody that's involved with that kind of team around the child, whether that be external, it be the primary school, it be members of staff that have worked with that child prior to them beginning to avoid school. Nothing is done in isolation. It's very much a multi-agency approach and supported by the family and by the young person. You're working in partnership with family and young people in a supportive role rather than, you know, yes, we want children in school, but it's very clear that sometimes there's other issues that need to be addressed before that can be a priority. And it's about, you know, having those discussions about actually, well, the priority at this point is the child's emotional health and well-being. And we're going to give time for that to work before we explore then where education fits. So it's getting that balance, that the child's emotional well-being and the child is very much at the centre of any of the interventions or supports.
And on that note too, again, I mentioned it, that the social work knowledge and skills that we have obviously through our bachelor's degree and further on, but that allows us then to engage with the school in terms of that macro perspective. So what policies are in place in the school? What does our policy actually say? Like, for example, I had not in Abbey, but I had a case whereby the child was being recommended to go to the sensory room, but that child had an experience of neglect where they were locked in a room. So it's about bringing that social work knowledge and saying, well, this child actually has an adverse childhood experience, therefore that sensory room is not serving that child's needs. So being able to have those conversations as well and challenge, which is unique as well, because we are a different profession, working very much in the field of education, but that also gives us a different set of skills, knowledge and values that we can bring to the table also, which I think is really, really important in terms of, you've said there, Claire, with regards to the Autism Commissioner and what they had said. And I think that's really important that schools do have multi-professionals feeding into how schools are developed, because I understand as well that one of the comments made was that schools in Northern Ireland haven't changed from the industrialisation era. So it's about bringing those multi-professionals on board to see how can we all work together to benefit this child and young person. I'll go down again.
I'll read Jerry's out. While I have historically emphasized school-based social work in my lecturing career, I am doubtful this is part of a basic social work education or ordinarily. If so, does this undermine this important role of school-based social work while highlighting a need to educate the educators and trainers?
I think I will take it down so I can read it as
read
well. And then we'll be able to get a response. There we go. Well, I suppose I'll start off, Jerry, by saying that it's obviously fairly new and developing here. And when we look at research from the likes of the United States, they do have master's programs to specialize in school-based social work. However, in terms of embedding it into the academic side of social work education, I think it would fall under that kind of integrating social workers into non-traditional social work settings. So I believe, and I know that the NISC have been very good in establishing some guidance for social workers working in charities or social workers that are working in non-traditional social work settings. I suppose one of the elements that would be maybe well known more in Northern Ireland was the social workers being embedded within GP practices and surgeries. So it's very much about recognising the role of social work in non-traditional social work settings. And I think that then would cover school-based social work. I don't believe that we're in a position at present where we need a specific module on it. I mean, one day, hopefully, that'll come. But just because it's developing at the minute, however, it is nice to see that it has been mentioned in a few of Northern Ireland documents.
Who provides supervision for the social workers? So we all have our own independent social workers. So myself and Charlene have Orla McGibbon, who has been fantastic in supporting us in our role. Again, as Dylan has said, it is you're surrounded by teachers, which is fantastic. But again, you're a bit of a lone wolf in a big system. And Orla has been fantastic in supporting particularly me and Charlene with that. So all of our social workers do have their own independent supervision. And again, that's professional accountability, as I've mentioned in my impact presentation. And we all make sure that obviously we all have that. And our employers obviously need to ensure that we all have an assigned independent social worker.
Yeah. And again, that in terms of the supervision for school-based social workers, the document that NIST provided has really excellent resources in that. If anybody is very much interested in that aspect, I would encourage you, or a school even considering at present about going down the route of employing a social worker, I would strongly encourage and recommend that you check out that NIST guidance, because it really sets everything out in terms of the employee responsibility and the employer responsibility, so you can quite clearly see in terms of governance and compliance what you would be responsible for. Julie Graham, how to manage any conflict as employed by the school, but if the school hasn't acted appropriately, are you stuck in the middle as you're employed by the school, or do you challenge on behalf of the child and family? This is quite an interesting one. So I suppose in terms of social work in general, when we remove the practice environment or who we're employed by, we have ethics. We're governed under the Northern Ireland Social Care Council. We have a code of practice that we must adhere to. And within that code of practice, if we are observing practice that is substandard, that we do have concerns about, even if that is through our employer as the school, we have a duty to really report that through to our regulator to ensure that those situations are acted upon. But in terms of the more lower level things I think you're referring to, Julie, I have certainly been in situations where I would say very much that my role is the advocate for the child. And whilst I work for the school, in certain meetings I will act as the voice of the child. And that, from our school perspective, is a very rich and diversifying aspect that's brought to the table in terms of the Board of Governors, because you're getting that child's voice. And the school welcome that, because it allows them to reflect upon their decision making and why have we made that decision. And it allows us to professionally challenge certain decisions within schools.
And I suppose I would agree. I think obviously coming in as a social worker into a school, we have a very different knowledge base. We have a very different understanding of thresholds of support that can be offered. And I think my school have been actually quite receptive and opening to me challenging if I feel that they're not offering the proper support or appropriate support to a family. So I think they've been keen to hear what I have to say. I'm very accepting that I suppose in terms of the area of social work and that support of a young person, that's our experience. That has been my, I suppose, bread and butter in terms of working in family intervention work. So they've been really, really open to what my assessment and intervention would be. And I suppose the other part, that is the bonus of us having our independent supervisors in terms of being able to seek advice and guidance if there's at any point that we feel that something is happening that hasn't been managed correctly. Then it's not only that you're the lone social worker in the school going forward and challenging and raising that concern, you've got that support and that backing, and you've also got the backing of child protection support services through EA, where anything at all that we need to seek advice on in terms of safeguarding or child protection, we're phoning child protection support services and getting their input as well. So again, although we're the lone social worker in the school, it's not in isolation. It is very much integrated within the school and embedded within that support service.
And there's also mechanisms that I've had to use in the past in terms of challenging potential professional decisions, not even within the school environment, but within statutory social work. And we're attending meetings. There's certain things that we might disagree with in that meeting, and we will have to professionally challenge that. And working independently, and also having that independent supervisor, as Charlene said, really allows us to channel that in a professional and appropriate manner, I suppose. I'll scroll down again, just it's easier to see on the screen, isn't it? Really?
Yeah.
So I think we've got there Naomi saying what great the position is. So within the EA, it's not like the trust in terms of the bands. And Northern Ireland's unique, as I mentioned at the start. We have our different education kind of subsectors, like Catholic Maintained, the control sector, integrated education, and each one of those have different funding mechanisms and different ways to manage their budget. So there currently is no set and agreed pay scale in Northern Ireland for school-based social workers. It very much depends on the school, and I don't really want to get into the salaries, but they'll be very much different depending on the sector that you work under. Controlled would be the strictest in terms of budget restraints and funds, whereas integrated and Catholic Maintained have a bit more flexibility there. So that's all I can really say to that in terms of that, Naomi. Claire?
Yeah, I read it out here. Good work in terms of potential support for children and young people. My concern is that is often incorrect in terms of EBSA not recorded correctly on school registers. What if the school is the cause of the trouble and EWS negligent in their duties and only intervene at prosecution stage? I haven't actually found that in terms of our school. EWS not fulfilling their roles or their duties. Certainly EWS, like statutory services outside of the school, have high caseloads and are working with maybe one or two schools at this stage, so maybe aren't able to always fulfill their function because of their high numbers. But that isn't out of reluctancy, or that is resource pressures, like we are seeing in our statutory services. So it's not a clear-cut example of EWS are not doing their jobs. I think they are very much doing their jobs and at a very high capacity with very difficult circumstances. And you can see that with our statutory services as well, in terms of maybe 30 minutes waiting to get through the gateway on the phones. So I think we are all trying our best in terms of supporting young people, impacting attendance. In relation to the EBSA, I'm not entirely sure just what you kind of mean about the inaccuracy of this being recorded by school registers. do you mean in reference to their attendance and how that's calculated or how that's documented?
I think there's often a question over the coding.
Okay.
And I think that also plays into, obviously, education in Northern Ireland is statutory. It's universal. Every child has a right to education, and we, in terms of schools, have to be very confident that if we're marking a child as say for example a code 8 or a code 9, sorry, which means the child has a CAMS appointment, that we have that evidence to say that that child has a CAMS appointment. I suppose with regards to that emotional based school avoidance, and again, I understand from the parental and carer perspective, how can you get a diagnosis of that? It's very difficult. But even if there's some sort of letter from a doctor, it allows school to record that correctly. Because from the other side of it, if school are recording that the child has EBSA, but they're not having any information from the parent or a medical professional or supporting systems, then it means that the school is actually then in breach of their legal responsibility, because they have been putting that child down as being present, but obviously there's extenuating circumstances with no evidence to suggest that. So in that way, you have to see it from both sides of the system. But definitely in terms of the emotional based school avoidance is something that we as social workers in schools are seeing a rise in. And I know that our colleagues in EWS have also reported that that is one of the factors that they are working to tackle as well and address.
So the next
So hope
one
that answers.
asking for copies of the slides. So yes, they'll be available on the website with the recording. That'll be next week.
Yes, that's fine. Great, we've done.
Tricia.
Yeah. Keeps sliding back, doesn't it? We'll have to go down the bottom. No, it's not gonna.
Michelle, as or just said, EWOs do EBSA with children and consider relationships in school and difficulties at school. That was the comment. And you see Ashling's?
Just got down to the bottom there. Yep, sorry, there's somebody said there that education welfare officers are social workers, and yep, that's correct. And we mentioned at the start of the presentation, Northern Ireland's very unique in the sense of our 4 nations within the United Kingdom, where we still require the social work qualification to practice as an education welfare officer. And then Tricia definitely saying it would be great for school social workers to consider capacity to provide practice, and it's just went off the screen.
Practice development days to students, maybe further down the line.
Yeah, that would be brilliant actually. And as I said, Fergal was hopefully on here, and he has also came through about the social work and community development modules as well. So we're starting to expand in terms of our sharing the knowledge of skill-based social work as well.
Kudos to the presenters. I like reading that one. That's a good one. Alison, big fan of that one. Thank you for the support, the EWOs, and your response. Yes, I mean, we're all working together. We all want the same agenda. We all want children to achieve well, and we all want them to be in school if they're well enough to be in school. That is, EBSA codes raised in EA training up to school to decide how recorded, even when child has EB report, we have case when EW allocated in the circumstance until court prosecution summons.
So the EBSA codes are up to individual schools, 100% clear. But as I kind of mentioned there, individual schools also have to be very, very clued in and attuned to how they're recording that for obviously their legal obligations also. But excellent points have been raised there with regards to EW, and as Emer said, we understand that the services are stretched in terms of Northern Ireland, which again brings into the importance of this role, because it allows for that early intervention, allows for that prevention potentially. So it just feeds back into that, the importance of the development of skilled social work in Northern Ireland.
I think that's it. Alison, I can't see any more questions, thankfully.
No. It was quite busy there in the chat, so it was. And nice big long ones. So has anyone any other questions you may want to ask just before we close up for today? No. So as I said earlier, we have recorded today and we will edit it and it will be available on the website, but we will send you the link to the resources probably at the start of the week. Also, really, thank you very much everyone for coming, and thank you to the panel and our presenters today. I think it's been very interesting and we've had lots of questions, and if you would like to pass any comments on or you would like the guys to answer any more questions, you can drop me an email and I can forward them for you. So thank you very much everyone.
Thank you.
Thank you, Alison.
Thank you very much.
Thank you.